Well, welcome everyone. It is just the top of the hour. So we will go ahead and jump in. Please note that today's webinar will be recorded. So I am Dr. Qadira Ali, and I'm the co-chair of the Health Equity Achieved Through Lifestyle Medicine initiative, along with Dr. David Bowman and Dr. Daphne Bascom. And I'm very excited to be with you all today to present the third and final installment of our Healers Healing webinar series. And so just one housekeeping note, we will be having a Q&A session at the end. So please, if any questions pop up as our presenters are sharing, please go ahead and throw them in the Q&A box, and we'll prioritize those during the Q&A session. Next slide, please. So big picture, when the Healers Healing series was first envisioned, we had a goal of really showcasing some real life examples of what it can look like to bring lifestyle medicine to the communities that are often overlooked or discounted or thought to be even too difficult to reach with the 6 pillars of lifestyle medicine that we all know well. From plant-based nutrition to stress management, physical activity. These are all pillars that we know are at the heart of the evidence-based positive outcomes that we see when lifestyle medicine is applied in multiple diverse settings. But we also know that there's some nuance involved, and there is some additional strategy involved in tailoring lifestyle medicine to fit every unique context, every unique community that we're seeking to partner with for improved health outcomes. So when the Healers Healing series began 2 webinars ago, our first webinar focused on the power of food as medicine and thinking about how we can create collaborations between healthcare settings and clinical spaces and community organizations who are doing the work of bringing food and fresh produce to patients and families and communities. And that was a quite instructive webinar, and we definitely learned a lot in terms of some of the themes and strengths that were involved in doing that work effectively. Our second webinar focused on physical activity, and similarly how different organizations are using the power of connection, the power of culture building to really bring physical activity interventions and programs into communities that are often not really the subject of running clubs and things of that nature. And so that was also instructive, many lessons learned. And so through the course of the past several months of this series, a few overarching themes have really emerged when we think about really what is at the heart of effectively doing lifestyle medicine in diverse communities. How can we effectively deliver these interventions in a way that is tailored and appropriate and well received by the folks we're looking to reach the most? Some of those themes include community, the power of connection, how we can use these pillars to gel and to create a culture. Another theme that emerged was creativity, the need for problem solving, the need to think outside of the box when we consider what collaborations might be essential to doing the work. Another thing that has emerged over the context of the series is the thought of cultural humility. How can we go in asking questions, learning, looking to listen to the lived experiences of the folks that we're looking to serve? And the last thing that has emerged over the context of the series has been the power of innovative community clinical collaborations. And I think today's speakers will really be a beautiful culminating example of what that can look like. Next slide, please. And when we think about the mandate of lifestyle medicine, which is really to equip patients and communities with the knowledge and skills to progress towards optimal health, first and foremost, the most consistent line of contact is often through primary care settings, right? This is where families and patients are initially interacting with the healthcare system. But despite being saddled with sick care in various forms, and we know the epidemic of chronic disease, the foundation of excellent primary care remains prevention. It remains disease prevention. And also, once it's there, how can we effectively try to turn the tide? How can we work on reversal of chronic disease? But how do we do this work effectively when we know what the healthcare system currently looks like, where we're saddled with very short visits, we're saddled with the duty to sick care and also the sense of demand of intervening in ways that aren't anchored in lifestyle medicine and other preventive tools. And so this is where the shared medical appointment comes in, which is this rapidly evolving model that addresses the urgent need of this moment to improve chronic disease management and also population health in a manner that's cost effective, that's community engaged, and also health equity oriented. And also, personally, as someone who's quite passionate about healthcare professional well-being, I think it's also very important to note that there are positive associations between shared medical appointments and other similar models and reduced burnout and improved sense of fulfillment on the job as we do this work, which can definitely be demanding on the job. So with that bit of framing, I would love us to move to the next slide, and it will be my pleasure to introduce our speakers for today. Both Dr. Chen and Jiana are really an exemplary model of what this collaboration can look like between community and clinic. And so it's my pleasure to introduce Dr. Dan Chen, who is currently in a board-certified internal medicine physician in internal and also lifestyle medicine. He's a primary care clinician practicing in Spanish and English at Esperanza Health Center in North Philadelphia. He leads a continually expanding initiative to implement a multidisciplinary interactive model of food, movement, and behavioral health to support positive lifestyle changes with patients and work towards health justice. Next up, we have Miss Jiana Murdic. She is a wellness warrior, food justice champion, and woman of the people. She brings over 15 years of experience in marketing, programming, education, and a passion for holistic wellness to Get Fresh Daily, which is a mission-driven organization cultivating community well-being by integrating plant-based living experiences, farm fresh produce, and culturally empowering wellness education. So please join me in welcoming first up, Ms. Jiana Murdic. Next slide, please.
Good afternoon, everyone. Thank you so much for that warm welcome. It truly is an honor and a pleasure to be here with you all today. And yes, my name is Jiana Murdic, and I would say that I'm first a mother. I'm a daughter, I'm an educator, I'm a plant-centered home chef, and I am a champion for the community and the founder of Get Fresh Daily. My pathway to this work is non-traditional. I do not have a background in nutrition or public health, but I do have a background in teaching. I do have experience in marketing, and I am very, very personally passionate about the importance of healthy eating and earth-centered living. And this is a picture of a harvest from our garden that we were getting ready for market. Next slide, please. So in 2017, after 8 years in school wellness, community health, and wholesale food production for a vegan restaurant, I founded Get Fresh Daily to address chronic health conditions in the Black community through holistic wellness and plant-based eating. I believe in food as medicine and actually started studying it from a very young age, from just a personal interest. And I learned that the diseases that most negatively impacted not only my community, but our society as a whole were food related and proven preventable and reversible through a whole foods, plant-centered diet. So I decided to figure out how to make this lifestyle more accessible and desirable. I believe healthy living should be promoted as a celebration of life and not something that's a treatment for illness. And in doing that, it feels like a punishment. Next slide, please. So in September 2000, I actually had a devastating a sequence of event that happened. I went to drop off my 3-year-old son to my father, who was going to be babysitting him, and found that he had died of a massive heart attack. And I came in the house, I had my son in my arms, and it just floored me. But who we could have never had anticipated that just 10 days later, his sibling would also die of complications with diabetes. And on Christmas Day, within 4 months of these initial deaths, his sister also died of congestive heart failure on Christmas Day. And I'm sharing this picture. This is actually a picture of my father. That he's the one with the hearts. And today, only one of his siblings are still living. They all passed from heart diseases and diabetes, and no sibling has lived past the age of 60. And so this impact on my family was and is still devastating. And as great of a loss of that was and continues to be, unfortunately, it's a loss that too many of our families have had to learn to live with. And so this experience is what really became the backdrop to my work. Next slide, please. And so actually, can you skip? I have this out of order. Would you mind skipping to the next slide, and then I'll come back to this one? Thank you. And so I started to connect the dots when I saw the effects that living in urban settings were having on my students in the classroom, and their over access of unhealthy junk foods, in alignment with predatory food marketing we're having on their ability to learn in the classroom. And I realized that this kind of dual effect promotes this kind of eating as a norm, that it's normal to come into class and walk around with black bags full of candy and soda and all of this. But it also articulates a message that healthy living isn't for them. This is for those other folks that live in other parts of the community. And so in recognizing the difference in the quality of foods and the way it's promoted in more affluent zip codes by comparison, it's clear to see that being well in marginalized communities is actually a radical act. You have to have fortitude and a very strong will to push back against a system that is designed for you not to be well. And then can we go back to that previous slide? I'm sorry about that. Thank you. And so I determined to give healthy living a marketing spin by celebrating its benefits, by thinking about and talking about health and wellness in terms of it being uplifting, lots of energy, vitality, vibrance, having fun outside, but most of all, serving lots of fresh and delicious foods. And in working with schools, I further realized the opportunity to reach and impact not just the students, but the entire school community, the educators, the school leaders, and the entire family. I guess next slide, 2 slides. Yes, perfect, thank you. And then when schools closed during the pandemic, there was an opportunity to connect more directly with those families and the communities that they lived in I was able to reroute some school-based grants and use those funds to be a feeding program, a produce box delivery program, and online cooking classes. And in addition to that, we realized the importance of being outside together. And we're starting to build community around being online on cooking classes, talking about the produce in the boxes and meetups in the garden. And that really became the winning formula. Next slide, please. And so by 2021, the initiative started to gain momentum, positive reception, and funding. And we gave the garden and the feeding project a name. It's called Freedom Greens and Gardens. And we dubbed it as a destination for wellness in the heart of West Philadelphia. The garden became home base for seasonal celebrations, summer camps, read alouds, and yoga and mindfulness events. And then last year, we actually launched Black Farmers Markets, selling farm fresh, local, and organically grown produce grown by Black farmers, and then selling it back to the Black community. And in fact, all the foods that we grow in our garden, we are very intentionally grow foods that support heart health as well as mental and emotional well-being. And the foods that we grow, we give back to the community as a pay what you wish. And so in that way, there's no stigma attached. You know, if you have $1, then you'll take $1. If you don't have any money, we'll take that. It's worked out really well in that, you know, people who recognize what we're doing, you know, will pay much more than, you know, you know, if we put a price tag on it. And so in that way, we're able to really have a shared economy and support one another in this health model. And all the foods we serve in the garden are always 100% plant-based. And we also have a policy that there's no soda, candy, junk foods allowed to be eaten in the garden, or served on the grounds or sold. And so that's just been such a beautiful offering to the community, and really, again, like integrating the holistic nature and really a focus on family and community. Next slide, please. And another key component of our Freedom Greens and Gardens initiative is our Fresh Takes produce box. And so that same box that we started as a feeding program during the pandemic, we were able to start to kind of curate and be more intentional about the foods that were in the box. And so our Fresh Take CSA ensures that all people have access to farm fresh, local, and organically grown foods. I really kind of put it together to be kind of like a plug and play model. So every box is specially curated with 7 to 8 ingredients that work well together in meals. And so in that way, you know, a lot of traditional CSAs have, you know, a lot of different things, but people don't know what to do with it. And I'm very particularly invested in what people are doing with the food. We want them to, you know, eat them in healthy ways and prepare them and serve them in healthy ways. And so took things a step further by curating plant-based recipes that go with every box that you know, are familiar, are culturally relevant, and very simple. And so the goal is to make plant-based eating easy, fun, and delicious. And for just $25, our goal is to make sure that people living with food apartheid throughout our city, that we deliver to people's homes throughout the city. So the goal is to make sure that there's access throughout the city, regardless of where you live. And then, so as an extension of that, this is, you know, it's a dream to have been able to collaborate with healthcare systems to utilize our produce boxes as a teaching tool. And so we actually were able to secure 2 healthcare partners with Esperanza Health Center, and that's with Dr. Dan, who's with us today, as well as Spectrum Health, which is actually located directly in the neighborhood that we serve. And, you know, with the idea being that it's very intentionally given and shared with people who have been identified with chronic health conditions. Next slide, please. And so I just wanted to share briefly that the model that we were working with Spectrum Healthcare, they very intentionally were able to get the funding together and the support together thanks to primary care physicians and nutrition educators that were very committed and interested in plant-based nutrition, and to put together a program, the 4-month pilot called the Prescription for Produce Plan. I'm sorry, I can't remember the name of it. PPPI. And it was really great because we were able to identify 35 families who received the produce box. All of them had diabetes or heart disease. And in addition to getting our produce boxes delivered directly to their homes every week for 4 months, along with those recipes, we were also able to, they still went into the clinic on a regular basis, saw the physician who was already invested in this initiative, saw their nutrition educator, as well as on-site nutrition education workshops. They got their vitals checked every single time, and the outcomes were really phenomenal. In fact, we had one woman in particular whose A1C3 was so high at the beginning of the program, the doctor thought she was like on the verge of really having, really detrimental health outcomes. And by the end of the 4 months, she had completely reversed her diabetes, and she 100% credited the produce boxes and her using them on a consistent basis, along with the support that she was having from her primary care physician for reversing that. We also saw excellent results in terms of controlled blood pressure. People were much better in terms of being able to control their health and more aware of it. And just overall more knowledgeable and more interested in just feeling that, this was something that they could incorporate into their everyday lives. Next slide, please. And so at the end of the day, in conclusion, I just really wanted to share that at the core of Get Fresh Daily and everything that we're doing at Get Fresh Daily, it's really about families. This is my son, who's actually working on at our farmers market that's in the center. And this is my family on the left-hand side. And so at the end of the day, this is about, getting a beautiful, long, healthy, quality life that we all deserve. And just on the right-hand side, that those are some girls that have been working in my program since they were in kindergarten. And, again, just the power of working in community and like really being able to connect directly with families, I think is the takeaway and how we can really make long-term change. Thank you.
Thank you so very much, Jiana. That was incredible, and I can't wait until we dig in with some questions. Next up, we'll have Dr. Chen come up to the mic virtually, and we look forward to hearing from you.
Thanks, Qadira. Thanks, Jiana. Love sharing this space with you. It looks like there's this slide. We recently won an award from the Pennsylvania Association of Clinical Community Health Centers for innovation for our program at Esperanza Health Center. So it's really encouraging and affirming to have others also recognize the value of what we're trying to build for our community. Next slide, please. I would like to take this opportunity to share how we implement lifestyle medicine framed primary care at Esperanza Health Center. And you'll see how our relationship with Get Fresh Daily, this allows us to address systems of health inequality for our neighborhood. So in the context of FQHCs and CHCs, I like to remind people of this man, Dr. H. Jack Geiger, who is considered one of the founding fathers of CHCs, who famously said, "The last time I looked at my medical textbooks, the specific therapy for malnutrition was, in fact, food." And he said this when he was being challenged about his use of pharmacy funds to meet nutrition insecurity. Next slide. So Esperanza Health Center is a Christian FQHC where we have 3 sites caring for our neighborhoods in North Philly. Our patients live in food apartheid. The majority of them have Medicaid and the rest are uninsured or have Medicare. And 85% of our patients are Latin E. So we run our lifestyle medicine program as a shared medical appointment. So instead of 15 minutes with one-on-one with a clinician, we have 2 hours together as a group. And in this time, we have a chance at multi-directional learning and human relationship building. It's about doing this together. And we incorporate, you can show the next slide, group movement. And we also, in the next slide, behavioral health. And we do didactics. And this is my favorite part, we get to do food. So I write and I demo a culturally relevant whole food plant-based recipe each week, and everyone gets to experience and taste. Next slide, we can see an example or examples of things that we make, and sometimes we get everyone involved. Everyone gets their hands in the mix. Next slide. So we know from plenty of research that Americans fall way short on the recommended intake of plants every day. And in our neighborhoods and communities, that number is even more depressing. And we also know that fruit and vegetable prescription programs improve health markers and food insecurity. And this is because it gets foods into people's homes, which then gets them into people, right? The people, we as people who are designed to be fueled and nourished by plants. This next slide, I love this poster because it affirms what we so often already observe and know. So pairing samples with simple demos increases the likelihood that someone will want to try it at home and is more likely to do so. So I guess the question is, how do we decrease the threshold to accessibility to fruits and vegetables, to plants, as low as possible, so that health promoting choices are the default or even the preferred ones? How do we honor people with real choice and quality food? Because is it really a choice if it's impossible to obtain, or if someone has never had the chance to try it, or they don't have any idea how to cook it? You know, I have patients who often say in the groups, or have said on multiple groups, my doctor will give me a list of things to eat, and I just don't do it because the risk is too high. I have a set budget for the week, and I need to spend that on something that I know how to make, that I know how it's going to turn out, that I know my kids will eat. But if I come to this class and do this together, I see how it's done, I've tasted it, taken it home to my kids, and they like it, I'm more likely to do that now. So next slide. So enter Get Fresh Daily, right? They curate these fresh takes boxes that go together towards a beautiful and delicious meal. It's hyper-local, organic, seasonal foods. And you can see here in our kitchen boxes that are pre-assembled, and they're picked. I forgot, Gianna, is it like within 48 hours? Or they're super fresh, all right? And then you can see the spread of what it looks like there as one example. And then the next slide, this is something we can make, right? So we're making mofongo, like a mashed garlicky root vegetable food over brown rice with a garlic cilantro sauce, bean based, and then we pickled some watermelon radishes and onions. Can make something delicious, beautiful, with flavors that are familiar and mouth-watering, right? Next slide, please. We have our garden where our patients can get their hands into some of the foods that we're using, right? We have cauliflower and broccoli. We had eggplant and cucumber, peppers. We have a nice selection of herbs that we get to use on a regular basis. So we don't have to be buying those $2 packets in from the supermarket, right? Patients come in, grab some herbs from the garden, take it home that day. We have rosemary and thyme and oregano. What else did we have? Cilantro and chives. All right, let's go to the next slide. Oh, this slide makes me really happy. It feels so aligned. So we have local schools come and use our gym at the health center. And we've developed a rhythm where I slice apples every Thursday morning when we have our class and serve it with a dip. Sometimes it's black beans blended with dates and cocoa powder. Sometimes it's cashew, dates, and cinnamon. And these kids genuinely look forward to fueling their physical activity time with these foods. And they're building a rhythm and relationship with fresh, whole plants, right? I don't know if you guys can see this picture. These kids look happy, and I didn't have them pose, right? They were scrambling over each other for this. And this is culture forming and relationship building, right? We're changing the expectations and habits, changing experience and exposure, and maybe what people are gonna call their favorite foods as they continue to grow and have this experience. Yeah, so I just love this image here. You can keep going. Next slide. And we get to do that as a community, and the people who want to get involved continue to grow, right? We have undergrad and grad students. We've had chef come by and spend some time with us, volunteers, all catching the bug. Here we have Juliana, who is a pediatrician from Brazil, now studying for her steps to be certified in the United States. Mary, who's an undergrad student. James in the bottom left, who's a chef. We learned a lot from one another. He's not a plant-based chef. He is a culinary trained chef. And we had a great time trying to learn from one another, build up beautiful and delicious foods with the ingredients that we have. Louisa, she's an undergrad over at Drexel. We can keep going. And we have partners with local college of public health, having students come do field work with us. We're going to start doing some research and surveys, also build in some of that programming so that we can continue to grow and do better and not just assume we're doing better. Really continue to tap in informal and formal ways with feedback from who we're trying to serve and who we're doing this journey with. Here's some more examples of foods that we make. And I show it lined up like this because, you know, our shared medical appointments have, when we first started them, sometimes we'd have like 3 or 4 people show up. And now we can get up to 19 people coming. With the sweet spot of actually, we're trying to hit around 8 to 10 in each group to be a very intentionally engaged time together. But what I'm trying to just show you guys here is how we change culture and conversation, right, in the health center. As we cook these foods, the smells waft and permeate through the health center. People walk by and ask, they're like, what's cooking? What's happening? People get to try things, and then they get a recipe that goes right with it if they want to try it at home, right? And this is how we sell it to people, right? Not financially, but like sell the idea and sell this excitement, right? As staff and leadership come by and taste, people are amazed, right? This food that is nourishing and health promoting is also beautiful and delicious. You can keep going. More examples. You can keep going. So yeah, we're trying to help increase access in food apartheid, right? In places where this normally isn't accessible for many reasons. And so how do we provide these foods to our patients and our neighbors and our communities in a way that helps them actually get it into their homes and into their families and their bodies, so that we can make an impact on the unnecessary excess burden of chronic disease, right? So Esperanza Health Center is not a stranger to having food drives or providing fresh food, but we've learned something over the years, right? We used to have these pre-packaged collections of foods, and people would come by and take the box that was neatly packed for them, and you know, within a block you'd start to see foods kind of strewn about, the things that people were not accustomed to using or were uncomfortable with. And so what the response of the health center, which I think was really appropriate, was maybe we weren't paying enough attention to autonomy and choice, right? So it started to be, hey, you can get a bag and you can fill it with the things that you would like to take, right? Instead of us being like, we're telling you what you're going to take home. But I think what that didn't quite meet was that relationship part, right? That part where we were going to share and live out new experiences that might be something exciting and enjoyable. Sorry, one second. Yeah, can you give me one moment during your presentation? Okay, I'll be with you in a little bit. Sorry, kids home for snow day. So we Yeah, so what we're trying to do also is to be able to give people a positive experience with some of these foods that they've never had, right? Patients, after coming to our class, our shared medical appointments, are like, wow, I never ate tomatoes or mushrooms, and now they're amazing. I think I know how to make it now. I know how to make it taste good, and even my kids are eating it. And that's, I think, it's not that we want everyone to be like, I love everything, right? But if people don't have a chance to experience it in a deserving way, right? In a potentially positive way, then it's not really a choice, right? And so that's what we're trying to do. We're trying to equip and have those conversations and experience together and grow together, learn from one another, right? And figure this all out together in a way that we're all moving in a positive direction towards the health of our neighborhoods, our communities, our societies. All right, let's keep going. So these are just some kind of takeaway ideas that I mean, I probably won't go through all of it, but I think one of the main baseline concepts that I think we really want to drive home is that everyone deserves a chance towards optimal health, right? This is the idea of health equity. And we want to set up opportunities, experiences, groups, right? That provide, a setup, an environment for meaning and purpose and reward that we can do that together. So, and in terms of nutrition, like how do we make plant-based foods, whole food, plant-based recipes, delicious and nutritious, to make them accessible and to make them enjoyable, to make that connection with food that we want to encourage, right? And to do that together, right? We are in a place in our society and world where connection is not necessarily the issue, but community, right, is where we're sometimes lacking, right? To do this together, to experience it as peers, and to have that affinity as we journey together. All right, let's move to the next slide. All right, so yeah, I mean, I'd love to continue this conversation. There's my Instagram if you want to follow along on things that I'm posting on in my life and things we're learning and developing. And there's my email if anybody's interested in reaching out.
Thank you, thank you, thank you, thank you, thank you so much. Please, everybody, a virtual round of applause for both Dr. Dan and Jiana for sharing this incredible model. And there's a lot of enthusiasm and engagement in the chat. And so we have plenty of questions to get through. I would love to start off with one, if I may, use my moderator power for one moment. I'm very curious, Dr. Chen, when you had the first idea to begin shared medical appointments at Esperanza, what was that process like in terms of speaking to leadership and justifying this model, particularly in the setting of this increased emphasis on revenue and volume and efficiency? So how did that conversation play out, and who did you have that with?
Yeah. That is quite the journey. It's only been a few years since we've been doing this, but when I first had conversations with leadership, I got a lot of polite nods, and like, that's a great idea. But I think a lot of it had to do with exposure, right? They were gracious enough to give me a chance to do a lunch and learn series. I forgot if it was 6 or 8 times where I would make a whole food plant-based lunch. Yes, you may go and watch. Yes. Okay, sorry. A whole food plant-based lunch. And we would talk about any topic, basically that connected lifestyle medicine, usually to a chronic medical problem. And it was up to the group what they would want to talk about. So we talked about diabetes, high blood pressure, we talked about sleep. One time someone wanted to talk about like scripture and biblical references to nutrition, and like what are there spiritual connections with how we interact with the environment and food and all that. And that actually was attended by staff and leadership. One of our medical assistants came to that, and she was so transformed by what she learned and what she applied into her own life that she became kind of a spokesperson for this in our health center. And she helped us translate curriculum for our shared medical appointments. She even taught some of the sessions for our shared medical appointments. And that was really exciting, right? To see people change in their conversations, right? And so staff will be talking about, oh, what food's being made today? Or sometimes I would bring extra lunches and put them in the fridge and send an email out to all staff and be like, hey, if you forgot your lunch, or if you just want a lunch, there's one in the fridge. This is what's in it, and this is how I made it. And people would email back or ask questions. A nurse practitioner group wrote up some of my recipes, and they like tested them basically. I asked them to give me accurate pricing and time, like how long did it take you to do it? And then some nutritional profile stuff. And they printed out a little booklet, and people would start passing it around. So these conversations started to happen. And then there was grant funding, to get some produce boxes with Jiana. We tested out a shared medical appointment, trying to see if we could get patients to come. And it was slow going the first couple cohorts until patients told patients. And then people started to come. And so I think that made a really big difference. And then leadership was like, okay, well, if you're getting productivity here, then we can keep doing this. And so that was the first step. There's still more that we're working through, but I think that's how it kind of started.
That's very, very helpful, just to have a little bit of a roadmap in terms of how you really found the end. And food wins always, really winning them over with the taste of what you have to offer. So thank you so much for sharing that. So speaking of grants and funding, this is a big topic of conversation and questions. We've had several folks ask, where do you get the funding to cover the boxes? How are you billing? So I would love for both of you to kind of address the financial dimensions of this collaboration, from the clinical side, from the produce side, and how you all work this through collaboratively. So maybe Jiana, you can kick us off on the produce side of things, since that's one of the core sources of need for funding.
Yes, absolutely. Of course, we're always concerned about the funding. And I will say that it's definitely a challenge. We started out, doing a lot of this work during the pandemic when there were so many dollars for preventative health, certainly like community feeding programs. We had a lot of money. And, quite honestly, last year, a lot of that funding ran out. Thankfully, what we were able to do is create dynamic relationships within those 3 years with Dan and others who were like, we were able to kind of jumpstart with some of our funding to kind of get the ball rolling, and enough time for, like as Dan said, like for his leadership to see the value in it, to then reinvest in it, to keep some of these programs going. But it's an ongoing challenge. It's very challenging to get food funded. It's much easier to get like education funded. The food is a challenge, particularly because we're really committed to farm fresh, local, and organically grown produce. We want to support our local farmers. There's a lot of giveaway, programs. And for me, I really would like to try to maintain a high quality produce offering for everyone equally. So we are working on some things, with SNAP, the food stamp program, WIC programs, and things like that. But it's an ongoing challenge.
Yeah, I think value is really important, and people deserve quality foods. I think that's a main issue that shouldn't be forgotten. So when we, like Jiana said, there are free produce programs and they are amazing. Sometimes the quantity that you can get and some of the quality that you can get is very meaningful in terms of redistributing food that otherwise would go to waste, right? That's quality, that's still good, and we can get it to people who otherwise wouldn't have it, right? But I think what we get from these CSA, these curated boxes with Get Fresh Daily is quality, right? And thoughtfulness behind how they're, assembled and what is being chosen. And I think that makes a big difference. And so highlighting the value there, I think is really important. And people, I think when you're able to pair recipe and like that box collection, that also is extra bonus for someone who's taking it home now to do something with, right? If you can't put two things together, then it makes it that much harder, right? It just sits in your fridge and kind of wilts and then disappears into your compost. But I think the other part of that is when we do the shared medical appointments, it's billable, right? It's not, I think you said somebody asked that question. So we can bill it under individual coding, right? You can do under time, right? And then complexity. The important thing is because the billing codes are still individual patient done, it is important to have an individual component in some way, right? We're addressing individuals, not just like talking head and a virtual audience. No offense here. These are people who are interacting with one another and with, the facilitators during that time. And so the way we do that is there used to be this thing where you would pull patients out one by one and spend a certain amount of time addressing an individual issue. And I think that is a very valid way to do things and very legitimate and fills the requirements for billing. I feel like it's very disruptive for the style in which I do these things. And so what I really like to do is engage each person as we have discussion and conversation. And then what I've done is I've asked my medical assistant or somebody else in our staff to be scribing these things so I can enter them into my notes as that individual component. And so that fulfills that requirement. The other cool thing is that our behavioral health person can also bill for her or his, well, in our case, her, discussion and facilitation of conversation with these groups. And that's where the number of people who are participating is really important. We want to keep it to like the 8 to 10 participant size groups when we do that for appropriate interaction and engagement, right? And so when we have groups that are larger, what we've done is we brought in 2 behavioral health people to create 2 different groups so that we aren't shortchanging people by just having a giant audience, again, talking head idea. This is about relationship building, right? And so there's revenue. My point is that there's revenue that comes into this. And depending on how the organization eventually budgets and does things, that some of that could potentially go back to funding access to produce and food and things like that. In our current budget, there's enough value seen here from our leadership that other grants have been pulled from to support the produce that we try to make sure is being provided to every patient at every visit.
Wonderful. Thank you so much for that comprehensive answer. And thank you also for walking us through just the broad strokes of what the shared medical appointments look like, and then also who some of the other team members are that you engage in these visits to make them more robust and value add in terms of the behavioral health and the nursing. So thank you all both for your answers.
I'm sorry, can I just add one quick thing?
Sure.
I just also wanted to add that in our model, our boxes are $25 per week. You don't have to, it's not a subscription. And my point to saying that is that we're also trying to build, an understanding with the community that this is affordable, that when you shop farm fresh and local in season, going to your farmers markets, we're not just talking about those who can't afford necessarily. We're not necessarily talking just to that, individual or those individuals. We're also talking about people who can't afford it, that can go to any other grocery store. We're just trying to educate them to understand um, how to shop differently and the value in doing that. And so just also that part as well, like if we are able to get like education funded and be able to teach people about the importance of it, the encouragement. And this is where in any community that you have a farmers market, we're just here in Philadelphia, but anywhere you have a farmers market, just encouraging people to invest in themselves and their health is another component as well in terms of the food.
Thank you so much. That's such an important point. It really, really is definitely a balancing act of just like elevating the value of high quality, local fresh produce with the really very real financial constraints that many families experience as well. So thank you all both. We have a very active Q&A box. And so don't worry, folks, if we're not able to get to your question live, we'll have Dr. Dan and Jiana try to get to some of them after. But we have a couple of questions just around customization and how do we address tailoring the content of the box and the recipes to the communities that you all are serving. Jiana.
I would,
Okay.
yeah, I would say to that something that I'm working on next. We really this whole initiative really grew out of a time of need, and so now, like as time has moved on, thinking about how can we make this be something that is appropriate and accessible to people outside of just Philadelphia. What I will say is that it is something that I'm working on because the foods that we really focus on are local and in season. It is about really trying to encourage people to shop local and go to their farmers markets, be able to connect with their local farmers, and in doing that, um, I think that I'm also working on a way to kind of teach people how to just shop with what they need and like think about that food for the week. I know people get really frustrated. They get gung ho, and I'm going to eat healthy. I'm going to go to Whole Foods. I'm going to buy everything organic. You spend $200 and then you don't use it, and then that's kind of a defeating um, feeling. And so I think that's again more of the education that I'm working to flesh out.
Well, thank you so much. We also had a couple of questions that I think could be paired nicely in our final couple of minutes around eligibility for the shared medical appointment program in terms of length of time. How do you select folks? And is there any financial obligation or requirement for folks to participate on the clinical side and then subsequently get the produce boxes? Dr. Dan?
The only requirement to join one of our shared medical appointments is to be a patient of our health center. Currently, we are doing our very first community-focused, community-facing cohort. So that's actually designed, grant-funded, particularly for people who are not our patients. So for the shared medical appointment, you need to be a patient. It's a medical appointment, just like any other visit you would have at the health center. It's billable to insurance. People pay whatever their copay, if they have one, for their visit, just like any other visit. We just try to make sure we have enough produce or the boxes of food samples for the number of people who will show up. And sometimes that plays into how I design the week's recipe. Like, how can I scale something very quickly if all of a sudden, this Friday the Eagles won the Super Bowl, so maybe kids will be coming to this group because you don't have school, so the parents might be dragging them along. So how can we scale something up, very quickly? And I think those skills are also worth having conversations about in the shared medical appointment, right? If we need to make food stretch a little bit more, we want something a little bit more filling, something longer lasting. I talk about culturally relevant recipes a lot. And yes, the majority of our patients are Latin, but that doesn't mean we're only doing tacos, pastelones, that kind of stuff. Although we do those things. It's basically, what do you all want to eat? I ask this not every week, but every so often, and I keep a running list of things that people want to eat. So like this week, we're making plant balls, right? They're going to be mushroom, bean, and kale based. We made a 100% whole wheat baguette a couple weeks ago. So the ones from before are frozen, and now they'll become breadcrumbs, right, for these balls. And so we talk a lot about like, how do you maximize and optimize the foods that we're going to be used as well. Every class gets actually what I say, their classes flavored vinegar. So we take a white distilled vinegar, and as we're cooking things and cutting up mangoes and pineapples, save those pits and cores, stick it in the vinegar. Now, over the next 10 weeks, we've developed a mango or pineapple flavored vinegar that now goes into the foods that we're cooking. And so we talk about how we work really hard not to waste, and we can start compounding and building on these skills and recipes as we continue to change things up and riff off what we've learned.
Wonderful. Well, thank you. I just want to express so much gratitude for both of you sharing your expertise and your time and your clear passion for the work that you're doing. And I know that there was a lot of engagement and enthusiasm from our audience members. And so I want to invite you all, if you have time, to just peruse the chat, because there were a couple of questions we didn't have a chance to get to, including sharing the recipes and any sort of kind of curricular resources. I think that would be very helpful as folks think about how they can start to apply some of what you've shared. So thank you both very, very much. Thank you to our audience. And I'm going to pass it over to Stacia to start to kind of wrap us up.
Thank you, Qadira, and just sharing the sentiments for our panelists today. Thank you so much, Dr. Chen. Thank you so much, Jiana. Your heart and passion definitely came across through this presentation, and thank you so much for your time. Dr. Chen, I just want to say thank you so much for your yes. This is the second time already you have presented for ACLM, and it's only February. And so you've presented twice already in 2025. So thank you. And then a big thank you to you, Qadira, for the mastermind behind this webinar. You had this vision over a year ago now, and you formulated a work group who came together to kind of think through what are some topics that we want to explore through this series. And Dr. Chen was actually in that work group. And it's such a full circle moment to see it close and him, be part of this webinar. So just thank you for bringing us all together. And even though this is the last webinar in the series, this is not the last time we will be touching on topics that focus on health equity. So we really want to keep this going, and we will definitely be looking into ways to make sure that this topic remains on the webinar schedules going forward. I just wanted to share a little bit more about our HEAL initiative for those of you who may be familiar with our HEAL initiative, those who may be new to it. It is an initiative of ACLM, and it is 1,000 plus members strong. So a community of health equity advocates who are just looking for innovative ideas and ways and to implement lifestyle medicine in underserved communities. And Dr. Chen is a part of the HEAL community. And Jiana, your work that you're doing is definitely aligns with the work that we want to share and give a platform to. And so the mission of the HEAL initiative is to advance health equity through lifestyle medicine solutions and also diversify the lifestyle medicine workforce. So we do have a scholarship program that is actually open right now, and I'll be sharing more about how those who may be eligible can apply to that in a couple of other slides. And then also just wanted to give an announcement, an update about HEAL around some leadership that we are welcoming in a couple of months. Next slide, please. And so everyone on this call, this is news. So I just wanted to share that Dr. Chen, who presented today, will be an incoming HEAL leader. So he is taking on the role of co-chair as Qadira steps down. And so this beautiful, again, transition and 360 moment is so nice to see as we close this webinar series. And then also we are bringing on Meryl Fury, who is going to take on the secretary role. And many of you have probably chatted with Meryl or seen Meryl in HEAL meetings, because she has been a very vocal and committed part of the HEAL community over the years. And so, as I mentioned, next steps, you can go to the next slide. Next steps to stay involved with HEAL and to stay part of the ACLM family. We hope that you will consider joining ACLM as a member and joining the HEAL initiative. We meet bi-monthly on these very topics that you heard today. So just really, HEAL is just a platform for us to share how we are engaging community through an evidence-based framework to bring lifestyle medicine solutions to underserved communities. And then also the HEAL Scholarship, which is open now. So if you are eligible or want to learn more, just take a picture or open your phone to get that QR code going. And next slide, please. And then this week, we have officially opened registration for LM 2025. And this is the place to be. If you want to be immersed in lifestyle medicine, if you want to learn anything from reimbursement strategies to delivering LM in underserved communities to practice resources and tools, this is where you want to be in November, in November of 2025. We do have a hybrid option. So if you are not able to join us in person, you can definitely join us virtually. And then last but not least, just a thank you to everyone who has participated today and who has joined us. Thank you so much for spending your lunch with us, and we hope that you take care.